Hi everyone, Anna Staley-Weiser with Discover Osteopractic Physical Therapy, here to talk to you today about shoulder pain. I've got 9 pro tips, some exercises, and some activity modifications that you can do right away at home to start getting your shoulder feeling better so you can get back to doing those things that you love to do. The first exercise I have for you is called the sleeper stretch. This stretch works on the back of the shoulder where it can get really tight and cause problems with alignment in the shoulder joint, and eventually leads to impingement right here when you try to lift the arm up and down. So to stretch out this posterior aspect of the shoulder, what you do is you lie on your side, elbow bent to about 90 degrees. You can let your head rest on the table, and you're going to rotate that arm internally down towards the table. And what you should be feeling is a stretch right in the back of the shoulder. If you're getting any impingement on top, what you want to do is lower that arm down a little bit to get it out of that impingement zone. If you're not feeling much of a stretch, then what you can do is try to roll forward a little bit until you start to feel it there. The next exercise is a stretch for the latissimus muscles. Right in through here, these muscles are really strong and their job is to pull and hold the arm down by your side. But if they get too tight, then they can limit your ability to reach up overhead. And so tightness here, if it's really tight and bound down, again, can cause impingement symptoms on the top side of your shoulder. So what you're gonna do is take a rope or a piece of resistance band, put it over a door, put your hand through the band so that your hand is kind of relaxed and it's easy to grip. And then you're gonna back up and lean forward and let that arm get stretched over your head. And hold that there so you feel a nice stretch for a good 30 seconds to a minute. Another area that tends to be really tight on people that have shoulder pain is through the pectoralis and the biceps muscles. That's from poor posture, and the movement patterns that we do all day tend to overdevelop this chest and biceps area. So to stretch that out, there's lots of different ways to do these things, but one of my favorites is to lie on your back with either a rolled up towel, maybe a pool noodle or a foam roller along your spine, and then you just let your arms hang down over that, and you will open up the chest and biceps area and get both sides all in one. So it would look something like this. I'm gonna use my foam roller, and I'm gonna lie on my back and start here, and then just let my arms fall down and hang. And you should start to feel a pretty good stretch in through there if you have any tightness in through the chest and biceps area. Another stretch that's really good is for the thoracic spine. If you're stiff in through your middle thoracic spine and your ribs, it can transfer into the shoulders by limiting proper ability for your shoulder blades to rest where they should, and also limiting movement through your torso, which then transfers into the shoulder. So one of my favorite thoracic mobility exercises is the foam roller. So again, I take my same foam roller and I would just put it under my middle back, kind of where my shoulder blades are. And I'm gonna lift up my hips and then just start rolling back and forth to loosen up that middle back area. Another really good thoracic mobility exercise that also stretches out the chest and biceps is the side-lying thoracic rotation stretch. I love this exercise. I give it to pretty much anybody that has neck, shoulder, and back problems. So what you're gonna do with this one is you're gonna lie on your side, and you're just gonna rotate your torso and let that top arm hang back, and then bring it back to the starting position. Maybe do that 10 or 20 repetitions on each side, maybe holding that last repetition for 30 seconds or so to get a really good long sustained stretch. Now let's get into strengthening exercises. The first area we'll talk about is the rotator cuff, specifically the posterior rotator cuff. It can get very weak and cause alignment problems, just like tightness in the shoulder can cause. And so we want to strengthen that posterior rotator cuff. One easy way, I'll demonstrate on this shoulder, is to take a towel, put it under the arm, and lie on your side. Hold a small weight in your hand, maybe 2 to 5 pounds, can of soup or something equivalent, and then just start doing some external rotation. You should start to feel those muscles in the posterior shoulder working and getting tired. Use enough weight so that you get tired in about 12 to 15 reps, and try 3 sets of that. The next exercise is for strengthening your upper back and posterior shoulder blades. This is very important for proper posture and proper position and stability of your shoulder blades as you're moving your arm. So what you're going to do is lie on your stomach, maybe a towel under your forehead, and you're going to start lifting your arms up against gravity. So lifting your arms to the back, lifting the arms to the side, and lifting the arms to the front. Those 3 positions will work all the key muscles in the posterior shoulder that are important for posture and stability. Next, we have strengthening exercises for the front side of the shoulder blade, the serratus anterior muscles. Those muscles work together with the muscles on the back of the shoulder blade to pull and hold the shoulder blade tight against your rib cage. So these muscles are engaged with push-ups and planks and some other band exercises, but a simple plank exercise, as long as you can do it without your shoulder hurting, you just put your elbows down, lift your hips, and push down through those elbows so you feel those shoulder muscles engaging, and hold that position for as long as you can, maybe 20 to 30 seconds. And if you can do that 3 reps, then you can start progressing into higher level planks and push-up activities. If your posture is poor and rounded, it puts your shoulder in a position that predispositions it for impingement problems. Just try it. Try raising the arm up from a standing tall position, and then try slouching and raising the arm up. You're going to feel some resistance on the top of the shoulder much sooner. So you want to practice good posture throughout your workday. Specifically sitting. Sitting is where people tend to slouch the most. So take your pillow, put it in your chair behind your lower back, and slide back in your chair so that the pillow, if you position it correctly, should lift that sternum and rib cage up, and the shoulders will naturally fall into place so that when you're working and you're typing, your posture is good and you don't have to think about it. Last thing I want to talk about is your sleeping position. If you're a person that likes to sleep on your side with your hand under your head like this, like a lot of people do, that can really put the shoulder in an impingement position and can in and of itself be the cause of your shoulder problem. So when you're sleeping, make sure your pillow is thick enough so that you don't feel like you need to put your hand under your head. You might need to add that towel roll on top of the pillow so that your neck is supported, so you don't feel like you have to have your hand there. You can have the towel there instead. And then this arm can just be out on the bed. You should sleep so that your arm doesn't hang off the edge. So slide back a little bit in the bed. And if it's your top arm that's bothering you, take a pillow here and put it under your arm so that this shoulder is well supported. So those would be the 2 sleeping strategies that you can do to help with your shoulder pain. So that, of course, was a very brief overview, but that basically shows you the most common exercises and strategies that you can do to help get yourself out of shoulder pain and maintain healthy shoulders. If you have questions or you're having trouble despite trying these things, please reach out to me. I'm happy to answer any of your questions. I'm only a phone call away.